Do you want me to just start translating or you tell me when?
Regional center, commercial insurances, and Medi-Cal and Medicaid services. So just a little bit of a disclaimer. This is not legal advice, and this is from the perspective of coming from a provider and BCBA lens. So we have a couple objectives today. The first one is to just get a better understanding of the APLs, or all plan letters, 23-010. The second is how to effectively collaborate with your ABA provider, school district, and the managed care plan to get access to medically necessary ABA services in the school setting. So we're going to dive into the all plan letters. This was released by the Department of Healthcare Services, DHCS. It's quite a long document. You're free to read it, but it's about 10 pages. So I want to just kind of highlight the more important aspects of the letter to pay attention to. So this APL was released or the most recent one was released in November 22, 2023, and it supersedes or takes over any all plan letters that were in place before. So it's still a fairly new letter, and it's going to take some time for everyone to still be on the same page. It's addressed to all of the managed care plans, or also known as managed care organizations. Today, I'm going to refer them as MCPs just to make it easier for everyone. But this document, this all plan letters APL, it outlines basically and provides guidance on the responsibilities for behavioral health treatments, or BHT services, that are covered for members under the age of 21. So MCPs, I'm going to kind of explain a little bit about that. They're Medicaid programs within each of the different counties in California. California's Medicaid program is usually referred to as Medi-Cal. More specifically in the Inland Empire Health Plan, also known as IHP, and Molina are some of the more widely used MCPs in this area. So a lot of the families here that are on Medicaid or Medi-Cal will have IHP or Molina. We do at Easterseals collaborate more with IHP, so I'm able to give a little bit of more of an insight on how to work with them more specifically. And you'll see here, there's others listed kind of in the close by cities or counties. You'll find LA Care, Optima, and Anthem Blue Cross are some other ones that you'll find in Orange County and Los Angeles. So this APL really only provides guidance for the MCPs and not the commercial insurance plans. These commercial plans are usually provided by an employer or covered California. And also be careful because a lot of these MCPs also have a commercial side of it. So just know and figure out what kind of plan that you have. So you might have a commercial plan that's through your employer, or you might have a Medi-Cal plan through the Medicaid program. But it's not to say it won't really affect the commercial plans in the future. This really is a stepping stone in the right direction to really ensure that all these individuals receive the appropriate care in the appropriate settings. So in the letter, it describes that the MCPs have the primary responsibility to ensure that these behavioral health treatment services are met across environments. So they specifically mention that the APL can cover things on site, on a school, or even virtual school sessions. They really have the responsibility to coordinate care with other entities and cover any gaps in medically necessary services. So I'm going to give an example for, let's say you have services that are covered by the school or maybe a regional center, and what's approved is maybe 8 hours per week of ABA services. Let's say a BCBA like myself goes in, reevaluates, and says he really needs 10 hours per week of these medical and meets that medical necessity for 10 hours. So the MCP is responsible to fund those missing 2 hours that the school district or the regional center is not paying for. The MCPs are aware of this letter. Many of them I know are working on linkages with the school districts behind the scenes. However, again, it's still new and a lot of them are still trying to figure out how to build those relationships with those school districts across the state of California. So it's still not a seamless process yet between the different systems and entities. So it's going to take some time before everything's figured out between the NCPs and the school districts and everyone else. So who's eligible for these services or for these benefits? So firstly, this is covered under what's called the Early and Periodic Screening Diagnostic Treatment or EPSDT benefits under Medi-Cal. Unfortunately, it only covers until the age of 21. Once they turn, your individual turns 21, funding for the services may stop. If they are a regional center consumer, though, the funding may be redirected back to the regional center if it's still medically necessary. You still need to provide that clinical support that it's still necessary after the age of 21. All types of diagnoses are covered under this benefit. So it's not just isolated to autism. It can depend. It could be intellectual disability, it could be Down syndrome, it could be ADHD. It really depends on the individual and their needs for these BHT services. You do still need a licensed professional, such as a physician, a surgeon, or a psychologist to make that initial referral for the services. However, the BCBA or the BHT provider will be the one that assesses the medical necessity. Another thing about the APL that it states in there is that the individuals need to still be medically stable. In other words, they shouldn't be in some type of hospitalization or require 24-hour medical or nursing care, or in some type of intermediate care facility. So those are kind of the requirements of to meet the benefits for this APL. So I've kind of been using the acronym for behavioral health treatment, BHT, and ABA services interchangeably. ABA falls under that category, behavioral health treatment. But this all plan letters technically covers all behavioral health treatments. So not just ABA, it can cover for behavioral health treatments such as cognitive behavioral interventions or CBT. They listed something as comprehensive behavioral treatment. It's very generic language training and other behavioral interventions that have been identified as evidence-based. So these are all examples from the APL. They provided other very generic examples such as peer training, social skills, groups, caregiver training, and natural teaching strategies. But all of these, as long as they're shown as evidence-based interventions, and the aim is to prevent or minimize adverse effects of behavior that interfere with learning and social interactions, then the MCP will cover those services. Keep in mind that BHT services are also provided and supervised in accordance with the MCP approved behavioral treatment plan. So there still needs to be some type of treatment plan created by the providers that are providing the services for you. They're usually called qualified autism service providers, professionals, or paraprofessionals, and they meet that requirement contained in California's Medicaid state plan. Although there's autism in the name in those titles, it still applies for all diagnoses that meet medical necessity criteria for the services. So just examples for ABA, this would be your BCBAs. With Medicaid, master level clinicians supervised by BCBAs are allowed to provide those services as well too. And then also behavior technicians are providers under this definition. So a very important aspect of the new APL is that it's kind of the first time anyone has really defined medical necessity. According to their definition, a service is medically necessary if if the service is necessary to correct or ameliorate effect or defects and physical and or mental illnesses conditions. They also define the word ameliorate as something to make more tolerable. So just keep in mind these definitions as part of medical necessity. It's nice that they actually defined it for once. So this can be used later on to kind of rationalize why the services are needed. The BHT services also need not cure the condition in order to be covered. They're there also to maintain or improve the individual's current health conditions, prevent the condition from worsening, and also prevent the development of additional health problems. So even maintenance services should be covered. It's really there to prevent any regression. So if there's times where someone needs some maintenance services in the future, if something happens, then the MCPs should be able to fund for those or approve the services that are recommended. Medical necessity decisions are still individualized. So the MCP can't really put caps or kind of standard hours on individuals. So really there's no service limitations or caps that are put on for providers when they're making their recommendations. Again, BHT providers, or in this case for ABA, the BCBAs, they're the ones that assess for medical necessity. So you'll most of the determination is based on their assessments and their observations. So I'm going to go briefly over mental health parity law. It's already a very large topic and a very difficult topic to understand, but I want to discuss how it works hand in hand with this APL. So just generally, California back in 2020, I believe, passed SB 855. And that basically says that all medically necessary treatment for a mental health condition must be covered as equivalent with physical conditions. So if things are not being imposed on the medical or surgical side, you can't impose that on the mental health side of things too. And again, they use mental health and behavioral health kind of interchangeably. So ABA still kind of fits under that mental health category for it. So I'm just going to give you an example of kind of the not the rationale, but just to connect things for you. Let's say an individual is diagnosed with cancer on the medical side. Typically, the treatment we know for cancer might be chemotherapy. And if it's deemed that this person needs chemotherapy to improve their overall health, and a licensed physician makes that recommendation, then the health plan should cover the costs for that treatment. So using that same logic with ABA, since it's evidence-based and it's been shown to improve the quality of life of many individuals with intellectual disabilities and autism, if a BCBA has deemed it medically necessary to receive ABA services, then the concept of mental health parity is in effect, and that treatment should also be covered by the health plan. So they shouldn't be denying it on that side if a BCBA is the one making those recommendations. Again, very complex topic. It could be a whole nother webinar to discuss, but I just want to show kind of how those two things are working hand in hand with this new APL. I'm going to go over what's not covered in this APL too. So, and this is taken directly from the language over there, and it was kind of hard to condense it, but just know that it won't be covered if there's no clinical benefit is expected any further. Again, the BCBA in this case still makes that determination. The MCP doesn't pay for the provision of coordination of respite, daycare, recreational services, educational services, or reimbursement of the caregiver for costs associated with participation. It also does not cover costs if the treatment is solely for vocational or recreational purposes. Custodial care is not covered. And this is basically defined as primarily maintaining the individual or anyone's safety. And these are services that also not a professional, that you don't need professional skills or training to provide these services. Other things, if these services are in a non-conventional setting, resorts, spas, and camps, they're not covered. If it's to reimburse services rendered by a caregiver, that's not covered as well. And non-evidence-based behavioral intervention practices are not covered under this benefit. So again, the coordination of care with the MCP, they are responsible for doing that and working with all the different entities, especially the school district, to ensure that this individual is receiving all medically necessary behavioral services. Many MCPs, like I said, are working in the background to set up those relationships. And in my experience, there are some schools out there that are more open than others. So like I said before, it's going to take a lot of collaboration on everyone's part and some patience as well too, as everyone's trying to figure out the process. But the first bullet point here, not contractually responsible for educationally necessary BHT services covered by the local educational agency. Basically, what this means is anything with kind of an educational goal, like math, reading, writing, has more educational background to it, doesn't fall under the what's medically necessary under the medical model with insurance companies. So the MCP see that as more of the responsibility for the school district to cover if services are needed for that. You have other different goals too, like communication, social skills, self-regulation. Those are things that the MCP can fund for, or those fall under the medical model as medically necessary. But just keep in mind that their goal really is not to duplicate services. So if the school is already providing BHT services there, and there's a recommendation for BHT services in the school, then the MCP just really has to ensure that they're not duplicating the services and the individuals getting double what is actually recommended. But again, like I said, there's going to be a lot of overlap with the goals, and that's kind of the MCP's job, is to assess if who's providing these services, where are they being provided, and just making sure there's no duplication. Let me see here. But their goal really is to make sure that these services are met on a timely manner, regardless of payer. So it doesn't matter if the regional center is paying for the services or school district is paying for services. They have that sole purpose to make sure that they are receiving some type of service. The MCPs also in the background were given this option to directly contract with school districts and fund for the school's own staff as BHT providers. They have that option too to also reimburse the schools for the services too. So those are things that MCPs are kind of probably working in the background to work with the school districts. But regardless of how they do it, they're still responsible to ensure that they're meeting all the medical and behavioral needs of the individual. So this is just kind of a little workflow that I've created. I don't know how many people are actually already receiving ABA services, but this is kind of just like the workflow of someone that's new into ABA. And I'm going to use IHP here as an example for this process. But if you're new to everything, the first step is you would bring your individual to your primary care physician or a licensed psychologist. With IHP, they make it very easy for those professionals to make referrals to the MCP. I know with IHP, they send the referral into IHP system and their case managers assign it to one of the providers in the network. Once that provider accepts the referral, they have capacity to take the referral, then they will start the assessment with the family and the individual and determine if it's medically necessary for BHT services. If it's not recommended, like in this workflow, the BHT services, the BCBA will either redirect the family to other resources and let the MCP know that it's not recommended at this time. But if they are medically necessary, then the BCBA will make that recommendation and send the report to, like, for example, IHP for them to review. IHP is one of those Medi-Cal groups that have been actually working and allowing school district services since several years now, and they already have a process down. So as long as the BCBA is filling out the proper paperwork to IHP, then those services can be approved in the school setting already. So if it's not recommended in the school setting based on the BCBA's observation assessments, then it just follows that same regular workflow of going into the home or clinic setting, wherever it may be, and providing services there. If it does go into a recommendation for a school setting, there's a little bit more work that needs to be done. So the IHP in this case will approve the services. However, you still need to meet with your IEP team to determine to add it into the IEP. So you still have to get your whole IEP team on board with the recommendation before you can actually get the ABA services there. So this is the most difficult part. Like I said, most schools or some schools are open, some schools are not. In my experience, some schools are more than happy to get that assistance with the individual or that extra additional hand there and recommendations. But there are other school districts out there that I have found would rather use their own staff to work with the individual. I don't know what the reason may be. They don't always disclose it. It could be liability reasons. It could be a variety of reasons or history they've experienced. But again, it's a little bit unfortunate that they can choose not to use your ABA provider that you're using at home. A lot of us would prefer it to be just one provider. That way you can ensure that there's generalization across the different settings in the home, clinic, community, or the school setting. But that may not always happen. And the schools have the right to, not the right, but they have the choice to use which providers they want to use. So if you are finding that you can't get access to your BHD services at the school, the best thing to do is to have your ABA provider reach out to your case manager at your MCP or even other contacts within the MCP, because they are the ones responsible to ensure that these services are being received in what setting is recommended. I don't know again what the process looks like yet, but we've worked with other insurance companies or Medi-Cal groups that were open to it, and some schools that were open to it, and it's been a seamless process with that. But according to the APL, the MCP is supposed to also provide case management services in the event that you cannot get these services approved in the school or have your IEP team agree to have it. I'm going to give some suggestions in a bit about how to collaborate with your IEP team. However, I do want to go over what occurs when ABA services are approved to be delivered in the school setting. Again, the IEP team still has to make a decision as a whole to include it in the members' IEP. I don't know what it's going to look like logistically in the actual document of the IEP, but I think everyone's still trying to navigate how that's going to look. It could be a new a service that's going to be added. It could be something in the comments. I don't know what it's going to look like yet in the actual IEP document. But again, the IEP team does have to agree to have BHT services in the school setting. And the same thing too is once that BCBA makes that recommendation, they also have the ability to recommend that it's no longer medically necessary in the school setting. When that happens though, the MCP is still required to continue funding for the BHD services in the school until the IEP is amended and signed by the family. So that could continue until everyone is in agreement. But the MCP is required to continue funding regardless if an IEP is not signed yet. But that's a discussion I would say to have with your BHD provider when they are recommending no longer no longer medically necessary in the school setting. So here are my key takeaways or suggestions to for ABA providers and how to kind of talk to your ABA provider for it. A lot of schools want to have something in place, such as what we call memorandums of understanding or MOUs. And this is usually between your provider and the school, and it really outlines the relationship between the entities. So for example, some MOUs might say ABA services will be funded by the individual's Medi-Cal. Or it could say the ABA provider will consult with the teachers and instructional aides, or it could even say the ABA provider is only there to observe the individual during school session. So it's something that's agreed between the provider and the school. But that's something that some school districts have asked us in the past to have in place before we start any services, just so everyone understands what their role is and kind of the limitations of what we can do. But work with your provider and having them reach out proactively with the school district to start those discussions. And some ABA providers have already pre-existing relationships with certain school districts. So that might be best to talk to your provider if they do already have a relationship with someone at the district. And furthermore, some ABA providers may also be non-public agencies, like Easterseals is a non-public agency, and that is basically approved by the California Department of Education. Some school districts prefer that your ABA provider be MPAs, that way they know you're certified under the Department of Education. But it's a lot of relationship building between the ABA provider, the family, and the Medi-Cal group as well too. So you just have to work very closely with everyone to get things approved in the school setting. My second kind of point is just kind of work collaboratively with all the systems of support. We all share that same common goal and we want the best for the individual. But I do recognize that there are some strained relationships between the school and the family sometimes. But just kind of figure out a way, have open discussions with them on what's the best way to kind of strengthen those relationships or come to like a middle ground with each other. That being said, people still need to be accountable for things in this process as well too. My last suggestion is really to start off small, especially if the relationship with the school district and the provider is not strong yet. Maybe the BCBA can go out there to consult or even just observe the individual. And once you start to see maybe improvements with the individual and that relationship is better, then have a bigger discussion on adding additional supports. But lastly, again, if you are running into those barriers, you should really engage the MCP in those discussions as well too. Because again, they are responsible again to make sure you receive those services and what's medically necessary. Here are just some resources. This is kind of the end of my presentation here, but this is the link to the APL. You can just kind of type in the APL number and that will pop up into the actual PDF document. Again, it's very long. And another resource for everyone is Council of Autism Service Providers. They're a really good organization. They're actually our trade organization for us ABA providers. And they really established what we call generally accepted standards of care that the insurance companies are recommended to follow or actually should follow. But they have great resources to provide anyone if you or someone else needs a better understanding of what ABA is. here is my contact information. Again, if you have any questions, I'm more than happy to help you guys in whatever you guys are facing or talk you through something. But feel free to contact me, and I guess we can open it up for questions.
Lots and lots of questions. Thank you, Ronald. I learned a lot, and I know this is new, so we may be asking some questions. Oh, we may be asking some questions that you don't know the answers to. One of the questions I saw was regarding after school. If a school has an after school program, would this apply to that, or does current regulations already apply to that?
It wouldn't have, usually after school programs are not part of an IEP services. So you would have to talk to the after school program. Sometimes it's ran by other directors or other organizations, for example, like Boys and Girls Club at some. You have to talk with them to see if they're okay with you providing those services. But like, for example, with IHP, it wouldn't necessarily be like a separate request for a school setting. It would be more of just the BCBA would just say a community setting. We might provide services in the Boys and Girls Club that's after school, but it doesn't fall really under this APL with the school settings. It still does, but it's not really an IEP. You have to like ask the school district's permission. It's really that after school program instead.
Can you give some, I know this makes BCBAs uncomfortable, potential hypothetical examples of behavior that might be allowed? We know that if it's directly related to education, that it's not going to cover it. But what would be some examples if somebody, a child wasn't able to sit in their seat and actually learn, or had, tantrums frequently? Would that be something that might be under this all plan letter?
Yeah, like I said, with the APL, it's anything that might prevent their learning. So if they have troubles maybe sitting down, or maybe if they eloping, basically running away. We've had those cases where like maybe they need two to one kind of instructional aids. That would fall under this like medical necessity. Again, the BCBA would have to assess to see if it's medically appropriate, but those type of behaviors that do prevent the individual from learning, I would see are medically necessary.
Yeah, I knew I'd make you uncomfortable. You have to pull out that medically necessary. Well, and for parents, that's such a, we hear the word, but it's also hard to understand, what is medically necessary versus an educational benefit. And
Yeah, it gets complicated when there's very different funders, because there's different laws that regulate which funders funding or where you're at. So with schools, it's the IDEA. With insurances, it's another set of rules. So like I said, there's the educational, it could be the math, it could be reading. Writing technically could also be could be communication and not considered educational, because an individual with autism may be non-vocal, and writing is what they do best as far as communication. So it really depends kind of how you frame it for people. Like with reading, that reading could also be a communication as well too. If that individual is non-vocal, you can teach them to read. And a lot of individuals with autism are visual learners, and so teaching them to read words to follow instructions, maybe they don't respond very well to vocal instructions, but maybe showing them the instruction written down, I would see that as medically necessary in the case, but you have to kind of make that rationale to the insurance company or to the Medi-Cal for it. As long as the BCBA knows how to rationalize that and tying it back to something more functional, like communication, self-care skills, self-direction. Those are kind of those areas within the insurance framework that would be under that. But if it's more of like, I want my child to read so then he can write essays or he can understand the story he's reading, they might see that more as educational.
That was a good example. What about a parent who has a behavior plan at home that's working, and then the child goes to school and either the behavior plan is not the same, or there's no behavior plan, or it's not really being enforced? Could that possibly be a case of medical necessity?
It could be, behavior intervention plans may be particular to one setting and it works in one setting, but it doesn't work in another. So that's where the BCBA will identify what's working here and what's not working here. And let's kind of assess what's going on in this environment to see what's going on. It also applies to different people. Sometimes the people follow the same plan, it doesn't work across that. And that's when the BCBA's kind of analyze a little bit more under that area of generalization, like why is this individual not generalizing skills across settings, across people, even times of day. That would fall under, I would see that would fall under medical necessity, because that we want that individual to follow, have or exhibit their skills in every single setting that we have. So that's kind of how I would rationalize that to be like kind of funded by the insurance companies.
So somebody asked, so if my son does not have Medi-Cal, does that mean this does not apply to us?
Like I said, it's this APL is under the purview of the Medicaids, like they're required to follow through them. But commercial plans is a different set of rules for them. And again, this is kind of like a stepping stone for the commercial side of things. So we're not there yet. But again, if you are a regional center consumer, Medicaid, there's something what's called a Medicaid waiver that you can get approved for, and it's not based on income, but because your individual has a disability, then that Medicaid waiver applies to your individual. And that's something the regional centers will help you go through.
Another person wrote, can a parent request that a BCBA go and observe a student?
They can request their own BCBA to make an observation. There needs to be a reason why. Just tell your BCBA why you want to have that. But again, a lot of schools, in my experience, sometimes will tell you no. Like you're not allowed to go observe the child unless you have an MOU signed by the district. So some schools are more open to it, some schools are not. So it really depends on the school.
Great. Sorry, there's a lot of questions. If the school denies access to the school setting, is there anything that can be done by the family, especially if the ABA provider is open into pushing into the school? And that might be a special education attorney question.
Yeah, that would be more something that you would have to engage a educational attorney for. However, again, if you have Medi-Cal, then your MCP is responsible to work with the school to get that initiated in there. So there's a lot of responsibility put on the Medi-Cal groups or the managed care organizations because of this APL.
I have so people want to know, who do they reach out to? If it's a family and they're interested in this, who should they reach out to first?
If you already have ABA services in place, talk to your BCBA. again, they're the ones that make those determinations, what settings are medically appropriate to provide services in. So if you already have those services in place, talk to your BCBA for that. If you don't have anything in place yet, like I said, the first step is talking to either your primary care physician, because they need to put that referral in or a prescription in for ABA services, just to start the assessment process first, because we always have to assess before the actual treatment is provided.
Here's a good one I hadn't thought of. This individual has a son who does not qualify for an IEP, but does have autism. The doctor is recommending an ABA therapist for support in the general ed classroom. Would this apply to that person?
Because that's a little bit difficult because the individual's not on an IEP. Your medical diagnosis, again, schools don't diagnose. They just determine eligibility for special education services. You can always challenge their assessments or their eligibility determination. There's a whole process of that with the IEP. You can always get them reevaluated, or what we call an IEE, individualized education evaluation. So that would be the way to do it, but it doesn't fit quite the workflow with the IEP in this. It's still a new thing. So I would think you would have to, one, try to challenge the schools for that, because it does have to be included in the IEP. But again, if you're in like a private school or a charter school, they're more open to working with you, and it doesn't necessarily have to be in the IEP. But I've seen some that are on 504 plans. And the school was needing the assistance and they were open to the help. So it could apply to those situations, even if you're not on an IEP. It could apply when they're 504, but again, it really depends on the school's openness.
I think I can see that we might wait a few months and then have a special education attorney
I know.
come and join us, because as Ronald says, this is new. And I think the schools are trying to figure out, the ABA companies are trying to figure it out, everybody's trying to figure it out. But there's definitely going to need to be some, probably more guidelines. This is interesting that they have Medi-Cal provider as a secondary insurance, and primary insurance is, of course, not. So would they still be able to access this?
So it really depends on the situation. Primary insurance, your commercial insurance is always the first payer. Secondary will cover whatever costs are not covered by the primary insurance, like for co-pays and things like that. However, if your BCBA makes a recommendation to your commercial insurance, let's say they recommended 20 hours, but for some reason your commercial insurance says, no, you only get 10 hours. Technically the MCPs should be able to cover those extra 10 hours that are missing. So you can use it in that sense, but that BCBA has to access the authorization from the MCP too.
I'm still looking. Could get covered. Somebody's saying it could get covered as an accommodation under 504 plan. So yes, that's possible. Sorry, this one's a long one. If the child is at school district that isn't appropriate levels of support, is it appropriate for a BCBA to make clinical recommendations to increase hours for services? So is that under medical necessity? If the child is not improving under the recommended hours, a BCBA could ask for increased hours.
They could. It really depends, like, who approved it, who assessed in this. If the BCBA in the school is different than BCBA in the home, then that can get complicated. But if it's the same BCBA that's providing services in both home and school, it's a little bit easier. You just have to go back to either the school to make that recommendation or the MCP. But if there's two different BCBAs in that case, there can be like a disagreement between the two.
Yeah. Well, and I can see a lot of parents are concerned, as I, is that if the school districts or if the insurance companies are going to be contracting with the school district's behavioral team, sometimes those members aren't licensed. It's not uncommon for school districts to have somebody who is not a BCBA writing
So
behavior plans.
So if the school district wants to contract their own providers, they still have to meet the qualifications under the California Medicaid plan, which is basically a BCBA for that. So it would be under those same rules. So unlicensed or not unlicensed, uncertified individuals wouldn't be able to
Okay. So
get
that's
it.
one protection. Another protection would be, as a parent, if you are not happy with the service and you try to remediate it, you can always file a complaint against the health plan.
Yeah, you can file grievances against the health plan if, and let's say the MCP is not helping you navigate or coordinate care in your school, then you can file grievances towards.
And that is something that Department of Managed Healthcare really watches, is grievances. There's a lot of power in filing a grievance. I know parents sometimes are hesitant because they're afraid of retaliation, not necessarily towards them, but towards their child. But it is a powerful tool that parents can use to get an issue resolved. All right, Melissa, I'm gonna ask you to come on too. There's so many questions. I'm trying to go through them all. I don't know if you happen to see any.
I saw when someone said, like, do you have to be certified to provide ABA in the schools? I think we were talking if the MCP contracts directly with the school in the background, and that's the relationship between the MCP and the school district, then yes, those staff have to still meet the same qualifications that are set for that the MCP needs to meet. And a qualified autism service provider is a BCBA.
Sorry, I keep
I see the one with Kaiser that says Kaiser participates in the Medi-Cal program. Does this APL affect them?
Yes.
well, if it's as long as it's Kaiser Medi-Cal.
Medi-Cal side.
Yeah. I think the other thing I'm seeing in the chat and the questions are families that are frustrated that they've been dropped from their ABA provider, saying that their child, has plateaued and is not making any more progress. And that kind of goes back to that medical necessity.
I think also too, one thing that at CASP, at Council of Autism Service Providers, with all the health plans, is there's this need of there's just not enough BCBA sometimes, and sometimes the health plans don't not all ABA providers take every single insurance company, but the health plans are responsible to have an adequate network of providers. That's one of the things that is part of one of the regulations. So that's kind of something we're working on with and talking with all the funders there. But again, it is a network, what we call network adequacy. A lot of the insurance companies just don't have a wide enough network of BCBAs or providers in there. So I could see that happening a lot. And I think that's just nationwide as well too. There's just not enough of us out there too.
And that could also be a grievance because
Mhm.
medical plans have an adequate network. So if they don't, then you can file. Here's a question. Can my child receive ABA support in the school if he has a one-on-one aide?
They can, they just need to be assessed first by a BCBA, because the one-on-one services at school aren't necessarily like for ABA. It could just mean they need an instructional aid, but it doesn't necessarily mean it's behavioral like one-on-one or ABA. So again, it still needs to be assessed by a BCBA.
Okay. Anything else? Oh, they want to know, who do we write a complaint to? They didn't get that part. So
You
to
would,
file a grievance.
to file a grievance, each of your MCPs have a grievance procedure with them. You can file it with the MCP first. And you could just Google the process. Most of the time you just call your member services or the number at the back of your card and then tell them you want to file a grievance. If it does not get fixed, then like you mentioned, Department of Managed Care is another one you can make a complaint towards.
I think that's it. We've just got a lot of questions. I know there's a lot of questions. I think we're going to have to do a part 2 to this with a special education attorney as things get figured out. I saw references to, the ADA 504. As we all figure this out, I think we're going to have to refine what the rules are and what the law says. And I appreciate you, Ronald. Thank you so much for taking on this. This was a big topic.
I know it's gonna be a big topic for a while. So
Yeah, big topic, and it's new. But thank you for at least kind of giving us an overview, and we will see where it's going. We appreciate you so much. Thank you to Liliana for translating. Thank you for Melissa for helping out, and thank you all for joining us tonight. Be safe out there, and we appreciate your partnership in our community. Take care.
yeah,
Bye-bye.
thank you. Bye.